Hi, good afternoon, everybody. Thank you. A warm welcome to all of you for joining us this afternoon. It's just on 2 o'clock, so I recognise we may have a few more people joining us as we open up. My name is Vicky Nelson. I'm an Associate Director of Transformation for South West London CCG with a focus on ageing well. And I'm merely chairing the session. I'm not the clinical expert at all, but I'd like to put a warm welcome to Dr. Aditi Shah and to Fiona White, who are joining us this afternoon. So this afternoon's session is a Q&A session. We have some questions that have come in advance, and then the chat box is open, so people are welcome to put their questions into the chat box, and then as we work through the session, we'll offer a option later on during the session to open up the phone lines if people are unable to put questions in the chat box, or if they've dialed in on a phone. But before we start, shall I just let the two of you, Aditi and Fiona, just do a little self-introduction to the group? That would be really lovely. Thank you. So I'll go to Aditi first.
Good afternoon, everybody. I'm Aditi Shah. I'm a GP in Merton and clinical lead for planned care. I may have spoken to some of you last week, so really pleased that you've all joined today. I also have a special interest in women's health in my GP clinical time. From a personal perspective, I have a young family as well myself, and I'm also married to another doctor, and we've both recently had our COVID-19 vaccinations. So really pleased to answer your questions that you may have today.
And I'm Fiona White. I'm a nurse consultant in primary care for the Federation and for the training hub, but I also work clinically at a GP practice in Morden Hall Medical Centre, where I have worked for 26 years. I manage the staff there. I am the clinical lead for maternity and transforming primary care nursing, and I am currently helping to deliver a lot of the COVID clinics across the Nelson and across the Wilson, and I've also done care home visits and housebound visits, delivering COVID vaccine. And I am a mother and a grandmother.
Great, thanks, Fiona. So lots of both clinical and rich personal experience, I think, as well, isn't it, that contribute to the session today. And just to reiterate the housekeeping, because I know we've had a couple more people join in, and we may have more people join as the session progresses. As if we can all keep your microphones on mute, unless you're actually asking a question, that would be helpful to keep the background noise out. And if you can just keep your videos turned off. We will be recording the session. We hope that we're able to edit it into a link, because not everyone is able to make the session now. And you're welcome to turn your video on if you're asking a question, or if you prefer to keep it off, that's fine, because it will be on the recording, of course. So I might then make a start then, ladies. So the first, and obviously I think if you just share between you as you feel comfortable, swap between, or if there's, I'm sure you'll work it out between you in terms of responding. Thank you. So the first question that I've got here is, someone was asking, please could you tell us about the impact of the COVID vaccine on women of childbearing age, and in particular the effect the vaccine may have on fertility or childbearing.
Would you like me to go first, Fiona?
Yes, I think so.
Yeah, so I think that's a really good question, and one that's got sort of several different steps to it. So when they did the trials, they didn't really include pregnant women in those trials. But since we've launched the vaccinations, lots of women who are either off fertile age as such, or those who are in high risk categories, so those that work in health and social care, for example, have had the COVID-19 vaccination. So looking at that in terms of the fertility, when they looked at the data, they didn't feel that there was any significant impact, and some people have asked around things like IVF treatment, and certainly the HFEA, which is the Human Fertility and Embryology Association, has said that you shouldn't have to delay your treatment in terms of the COVID-19 vaccination. So it shouldn't have any impact on your fertility. If you're going to be having IVF, it's a good idea to be having your vaccine anyway, because you've got your protection in terms of the COVID-19 severity. And if you are pregnant, then it's important to discuss it with your healthcare professional. But again, the vaccine can be given in pregnancy for certain groups as well.
I think I concur with what you say. Also, a lot of people do ask questions about breastfeeding, which might be another question that people are asking. It's very safe to be given the COVID vaccine during breastfeeding. When you come to the clinic, you of course will be counselled, and if there are any further questions, we will not give the vaccine unless you feel very happy and confident and you're able to give an informed consent. If you defer, we're happy with that. If you come to the clinic and you've changed your mind, that's not a problem. We can always find further information for you if you need it. But as Aditi has already said, that for the high risk category groups, the benefits outweigh the risks. So it's really, really important that these people get immunized, because if they do contract COVID, which you could still contract, it might be less dangerous for you because you've got some additional protection.
And I just wanted to pick up on something that Fiona said, actually, and a personal story, actually. So I have a baby who's just turned 1, and it was actually Fiona who gave me my vaccination recently. By coincidence, we're both on the webinar today. But she did exactly that we went through that process. She made sure that it was something I felt comfortable with. We talked through the pros and cons of it, but absolutely that I felt that protecting myself and possibly, we don't know yet in terms of the research, in terms of babies' protection as well, like some vaccines do, I thought that was really important. And so just to share that personal story that I'm breastfeeding myself, and I chose to have the vaccination as well.
So I think someone just also said, so can it have a negative impact on fertility at all?
So there is no evidence to suggest that there is a negative impact on fertility. These are new vaccinations, and we always look for any side effects, and they're always monitoring those things. But at the moment, there is no evidence to suggest that there's any impact on fertility. And actually, if you were to get pregnant, there are certain groups where if you have COVID-19 in pregnancy, it can have more of an adverse impact. There was some research done through Oxford and several other hospitals across the country, which was supported by the Royal College of Obstetrics and Gynecology. And that showed that women of BAME backgrounds, those who are overweight, those who are older during their pregnancy, suffered from worse symptoms of COVID when they were pregnant compared to the general population. And so I think it's really important to think about that as well, that it's better to protect yourself and have that protection there should you get pregnant in the future as well.
Can I just pick up a couple of issues from the chat? So one is, if you work in a care home and you've missed a care home visit, and following this presentation you change your mind, of course we will be coming back to the care homes for the second vaccinations, but you can always go to any of the clinics, either at the Nelson or the Wilson, as long as you notify them that you're coming, and get your vaccination. So anybody can change their mind, and we will welcome you at the clinics. You will not be turned away if you've got your ID and we have got vaccine in place. We think that you're a high priority group, and that you can have the vaccine. And when I went to a recent care home, we had lots of staff that were really able to ask questions and a great big queue lined up because they were confident that it was something that they wanted to have done, and they were protecting not only themselves but their families. Now, there is another question here. So once you've received the vaccine, can those that have received it still spread and carry the virus? So my answer to this is, even if you've had the COVID vaccine, you can still contract COVID and you can still spread it to your family members and to the people that you look after. You may be asymptomatic, or you may have symptoms. So that's, if you work in a care home, that's why, or work in primary care, that's why we have lateral flow testing, so that we can pick up people who have contracted COVID and potentially can spread it. So really, really important that you have the vaccine, because you might get it less severely, the COVID disease, and that you're protecting others. But you still have to be very mindful that you have to wash your hands, keep your distance, and follow the infection control guidance, because you can still pick it up. I always say to my patients that I've immunized, just because you've had the injection, you can't go off disco dancing. You are going to be doing exactly what you were doing before you came to this clinic. You are going to keep isolated, you're going to keep your distance, you're going to wear your mask. Just because you've had the immunization, and most of you will only had one, it is not 100% effective with one injection or even two. We don't know at the moment how much protection you will have, and there's a time interval between the first and the second injection. Normally about 10 days to 2 to 3 weeks, you will confer some immunity, some protection against the coronavirus. But that can be individual, depending on the person. And so you need to wait for your second immunization to get the maximum immunity that you will get as an individual. But you still need to protect the public, your family, the patients you look after, because this virus is doing strange things out there, and we are finding out new things about it all the time. So be safe is what I keep on saying.
Thanks, Fiona, and that's right. And it's all those same things, isn't it? Even once you've had the vaccine, about your wearing your PPE, keeping your social distancing, and isolation. Still, all those rules about that are still in place, aren't they? Yeah. And it's just a few more questions that we'd had in advance that I'll refer back to, because I can see one in the chat, but we'll come back to that. And I know you talked a little bit about this, but someone had specifically asked and said they're on hold for IVF treatment and been offered the vaccine. Can they have the vaccine before their IVF treatment or during their IVF treatment?
Yeah, so if you want to read about this, then you can go to the HFEA website, which is the Human Fertility and Embryology website there, and they give you more information about that. But essentially what they confirm is that those who are trying to become pregnant do not need to avoid pregnancy after the vaccination. And so from that, what that means is that you can have your vaccination, go on to have your fertility treatment, and that is absolutely fine. And as I said before, that actually having that additional protection in pregnancy is helpful as well. So that is national guidance that it is fine to have the vaccination, even if you're going to have IVF treatment. And I can see Fiona nodding her head there as well.
I was just going to say, I could post, I'm trying to see if I can post a really good video about pregnancy and COVID on the chat that people can look at. Is that okay if I post it, Vicky?
Yeah, that's great. Thank you. That would be excellent.
So this one is pregnancy. So I looked at this last night in part of my preparation.
Thank you. And what I will say is, if people would like a link to the video afterwards, if you put your email into the chat, we can always send it back to you directly. We will send it to managers, but I know some of you are hopefully staff members who've joined us today. Then one of the other pre-questions that came in advance, almost the opposite thing, is about contraception. So are there any risks of interactions with contraception if you have the COVID vaccine? And some people saying that they've got an implant, some people they're saying that they've got a coil. Is there any sort of risks to that?
My message would be, if you feel confident to have the vaccination, go ahead and have it. Your contraception shouldn't interfere at all with any of the with either of the COVID vaccinations that are available at the moment. If you have an implant, by all means, let the person who's vaccinating you know that your implant is there in your arm. But the site of where the needle goes in for the vaccination is completely different to where your implant is. And so it shouldn't have any impact at all on that either. So I think we can say with confidence that whatever type of contraception you have, it is perfectly fine to have either of the COVID-19 vaccinations.
I can see Fiona nodding. Yes, absolutely. I know Fiona's also very experienced with in the contraceptive field. And then sort of going to the other end, in a woman's life cycle, we had some questions come in around menopause. So people saying, I'm going through menopause and different kinds of symptoms people have had. And is the COVID vaccine likely to impact on menopause? Some people saying they're on HRT and worried about, will the COVID vaccine have any impact on the HRT treatment that they're receiving? Well, you're just on mute, Fiona. Sorry.
Shall I start? So it's quite a common question that actually some women do actually ask when they come to the clinic. And I have seen no evidence that it impacts on any of the symptoms they have. So if you have the COVID injection, what I say to patients is you might get a localized reaction, little red lump where I've put the needle in. You might get a headache the next day and you might feel a bit achy. You just have to take some paracetamol. If you do get other symptoms, occasionally, very rarely, some people will say, I've had a bit of a temperature or the symptoms have carried on. We can't 100% say that it's related to the COVID vaccine. It could be that you were brewing something anyway, but that seek further medical advice. So contact your GP if you do get any more side effects. And of course, it is a new vaccine, so we're finding out new things about this vaccine. And it's really important that if you do get any side effects, that you do speak to your GP, because they have to do something called a yellow card, which any new medicine that comes out, we have to notify an authority to say these are the symptoms that people are presenting with. That's all gathered together, and then when the evidence is sufficient, then we get notifications of true side effects from new products that have just come out. So it's part of the learning culture that we have, that we report side effects and that we use that evidence for future immunisations.
Thank you. That's really helpful. Thank you. And we had another question that had come in the chat, a more general question about if you have tested positive to COVID-19 and you've been unwell, so not asymptomatic, or I guess indeed if you have been asymptomatic, how long should you wait until getting the vaccine?
So the criteria is you've got to be 28 days post-COVID infection before you can have the immunisation, and we will not give you the immunisation if you've been in contact with a COVID positive patient in the last 10 days. So you have to wait longer than 10 days to make sure that you're not brewing the infection, and then we're happy to immunise. I mean, I'm quite happy to say the banter that I say when we do an immunisation, because I think that's really helpful. So this is what I say when a patient comes in front of me. So I say what my name is. I say, I'm Fiona. You're here today for whichever vaccine you're coming. It's either the Oxford or it's the Pfizer vaccine. Are you happy for me to go ahead? But I've got some questions that I need to ask you. So, are you fit and well? Have you had a temperature in the last 48 hours? Have you ever had a serious allergic reaction to any drug, medicine, vaccine or food? Are you on a specific drug called warfarin, which is an anticoagulant drug, which some patients have? And the reason we ask that is because these patients have regular blood tests, and the range of their blood test has to be less than 4 before we immunise them, because they're more likely to bleed. And so that's a specific drug that we look at. If you're on other drugs like clopidogrel or another anti-blood thinning drug, we're not so worried about them. We also ask, are you pregnant? Are you breastfeeding? Only because we want to know whether they're pregnant or breastfeeding, so we can give them more information. Have you ever had any foreign travel in the last month? So that's international travel, because we're interested if you've come, because you mustn't really have the vaccine if you've just come back from Africa or somewhere, because you should be shielding. And so it's really important that you're not in the clinic. Have you been in contact with anybody that's COVID positive in the last 10 days? And have you had COVID in the last 28 days? So if their answers are okay for those questions, then we say, well, you can have the vaccine. Are there any further questions that you want to ask? And if you haven't, can I have your left arm? And it's going to be in your left arm. You might have a little localized reaction. You might get a headache the next day, and you might feel a bit achy. And that's it. They're the questions that we ask. I don't think I've missed anything, have I, Aditi?
No, that's completely correct.
Normally use. I think I've said it about 3,000 times.
Yes.
So.
Oh, thank you, Fiona. So I think that helps, gives a little bit of, an overview, doesn't it, of things to not be concerned about, I guess, and the process that people would go through. And there was an interesting question that came in advance, which builds on the sort of side effects and, as you said, previous reactions. And I'm hoping the caller is on the line because it's quite specific. So they are saying they're 51. And in 1990, they had a vaccination for the typhoid fever. And within about 10 or 15 minutes of it, they had a very bad reaction, feeling as though their head was going to explode. And luckily, their mum was with them and took them to the nearest hospital where I got treated. So they're wondering if it's safe for them to have a COVID vaccine. So I think that's about people who've had quite a strong reaction in the past, isn't it? Is it?
Yeah. So there is evidence that's come out. So with the Pfizer vaccine, they say you can be allergic to 1 or 2 drugs, and there's no significant adverse events. For the Oxford vaccine, you can have adverse events to up to 4 drugs, and even have an EpiPen or use an you might have used an EpiPen. And so that vaccine is most probably at this point in time slightly safer for them, because we know of the profile of that drug. So if you come to a clinic and they're just offering Pfizer that day, because it's dependent on what the government delivers to us, we will say maybe because of the side effect profile that you've had in the past, we will keep your name and your telephone number, and we will contact you for the next clinic that is delivering the Oxford AstraZeneca vaccine, and then we phone them up. And invite them in as soon as the vaccine comes in. So that's really important. A patient has a choice. They can choose. If they don't want the Pfizer because of clinical grounds, they can have the Oxford, or vice versa, because people need to be happy with what medication they're getting. Now, the only thing that's different is when you come for the Pfizer medicine, or vaccination, we do ask you to wait 15 minutes in a waiting room under observation and then leave home. With the Oxford vaccine, You do not have to wait. You can just leave because it's a safer profile. But for a couple of reasons, we do say to patients, if you're the driver, please don't drive away without being around for about 15 minutes. Or if you've got an EpiPen or had to use an EpiPen, please stay for the next 15 minutes so that we make sure that you're happy before you leave. Now, occasionally, people are so anxious when they come to the clinic and they haven't been out for months and months, so it's a big outing for them, and they get quite scared of all the people and the risk that they are a bit wobbly, and some people will have, you know, a bit of anxiety. But we reassure those people and we make sure that they're checked out either by a doctor, because there's always a doctor or a clinician like myself that will come and do your blood pressure, make sure that you're well enough to leave. So occasionally people do get a bit of a panic attack or a bit of anxiety, but to date, apart from people tripping over their shoelaces in the clinics, we haven't had any serious adverse events.
And just to add to that, obviously that vaccination was given quite some time ago and we don't really know what the reason was for that headache. But there are a few things that all of us can do before we have a vaccination. Make sure you're hydrated. You know, all those things that we forget to do when we're busy at work. Make sure you've drunk enough water. Make sure you've eaten enough. All of those things can contribute, especially when you're feeling a little bit anxious about having a vaccination. And so those are just general things that are helpful to do before you come along, so that you've got enough energy, you're well hydrated, and so even if you feel a bit more anxious and your heart is beating away, then you've got that hydration on board as well.
Thanks, Aditi. Thank you. And I think just to add in, just around being able to access the vaccine. So as Fiona said, there have been visits done out to the care homes, and if we've got care home staff, their colleagues may have received the vaccine when the teams went out. And most of the boroughs have got some kind of system in place to try and keep supporting that on an ongoing basis. But we do still have the single point of contact is running at the moment for both care homes. So I put the care home staff, I put the email up a little bit higher. It's just carehome.covidvaccine@swlondon.nhs.uk. Or if you're working for a domiciliary care agency or social care organisation, then it's homecare.covidvaccine@swlondon.nhs.uk. So if you just put through your basic details, so your name, phone number, email, and the organisation you're working for and the borough that you work in, through to there and let us know. And we currently have, there are 6 self-booking, so 6 hot hubs. And that you can be sent a self-booking link for. And we've got 2. So there's one in Teddington Health and Social Care Centre, and then Hawkes Road Clinic in Kingston area. So they both have AstraZeneca. And then we have at the Royal Marsden Hospital, it's got and AstraZeneca is the Oxford one. And then at the Royal Marsden Hospital, it has the Oxford one. And then we've also got Epsom and St Helier, St George's in Southwest London and Croydon offering the self-booking links, and that's the Pfizer vaccine. So they all have, I'm going to say they have lots of availability right now. Social care and care home staff are a priority until the 15th of Feb, so you can probably send email right now and you'll probably get a link back before the afternoon's out and you can book your appointment for tomorrow probably, or maybe even this evening. We are aware that there are some people who feel a little bit concerned about going to a hospital hub, or there may be issues about the travel, anxiety and so on. So if that's an issue, please just let us know when the referral comes in, and do share this with your colleagues as well, because as Fiona said, we're also working with the GP sites, or they call them the primary care network sites. So in Merton, there's the Nelson and the Wilson. So we're working with the Leeds in there and in the other boroughs as well. So you could potentially get your vaccine at a GP surgery if you're really anxious about going to a hospital hub. And we're also just talking to the pharmacies because they're going to be starting to have some availability as well. And as I said, we recognise some people may have, quite a level of anxiety about going into a hospital setting. So lots of options, and lots of, fabulous people like Fiona and Aditi out there who you'll encounter when you get your vaccine. But I'm just going to. We've been talking about the Oxford and the Pfizer, and I think you have really talked a little bit. It's been interesting. Just about people who have allergies, that they may need to think a little bit more, and depending on the severity. But is there any other differences between the two vaccines?
I think there's a time interval between the second dose. So the Pfizer vaccine, they did say there was a 3-week time interval from the first to the second, but that has been moved to 12 weeks currently, and that's the current guidance. And the rationale behind that is to make sure that as many people in the public have access to that vaccine as possible. From a public health point of view. The time interval for the Oxford vaccine for the second dose is 4 weeks, but the same thing is happening for that. So you will have to wait up to 12 weeks for your second dose. We do code it. The information does go to your GP records, so you will get, they will get notification, and the GPs do searches and will notify you when your second dose is overdue and signpost you. So that process hasn't happened yet because we haven't had the 12-week time interval that is up, but I'm sure that will happen. With regards to the vaccine, it's the same kind of banter that we talk about and screening questions that we ask about, except for we would guide somebody that's got a lot of allergies most probably to consider the AstraZeneca Oxford vaccine if they're anxious or we think they're high risk because of the safety profile with that currently.
And I would add to that, just in terms of the way that they work as well. They do work slightly differently, but the main aim is to protect you against COVID-19. It's like creating a little army in your body, which is defense against more severe disease. So the Pfizer vaccine is an mRNA vaccine, which basically just stimulates your body to create a protein and tells the immune system to start working and create that immune response. So creating that army in your body. The AstraZeneca Oxford one works in a slightly different way. It uses a completely inactivated virus, and again trains your immune system to produce that army to fight the COVID-19 virus if you come across it. So both of them work to act as a sort of defense system for your body if you come across the virus, reducing the severity of the disease. If you're fit and well, then it doesn't really matter which one you have. However, as Fiona has said, if you have specific things like you're allergic to one of the ingredients, two or more of the ingredients, or one of the ingredients in the vaccine, or if you have had an allergic reaction to two or more groups of medicines, then it's really important to discuss that, and we can then guide you to which vaccine would be better for you. If you've ever had a severe reaction, an anaphylactic reaction, then it's really important to discuss that with the person that is giving the vaccination to you, or any other people you speak to, healthcare professionals, before you have that vaccination. So they work in slightly different ways, but if you don't have any medical reasons why you can't have one of them, I would say go with the one that's available. The sooner you get the vaccination, the better you're protected. And that happened to myself and my husband, that the day I went, it was the AstraZeneca. The day my husband went, it was the Pfizer. We had them a day apart from each other. I probably had a few more side effects than he did. I felt a bit more tired and fatigued, but it was all fine within 24 hours. It just meant that I had to leave the kids with him for a little while and give myself a break instead.
Can I also say, if you have one vaccine, your second one should be the same vaccine. So if you have the Oxford one, you need to have the Oxford one next, because that is how the safest way to go forward. And the other thing is, if you choose to have your vaccine in the care home, you will only ever be offered the Oxford AstraZeneca vaccine because of the storage. So the Pfizer vaccine has to be made up in a specific way and stored in a specific way. And so there's much more flexibility around home visits and care home visits with the Oxford one. So if you forget which vaccine you've had, you'll all be issued with a little card, but those cards disappear in your handbags. You will know that if you've had it in a care home specific, it will only be the Oxford one that you will have been offered. The rest, we will have the records on your notes, so you can always check with your GP if you've forgotten.
Thanks, Fiona. And yeah, just to say, if anybody care home staff would prefer the Pfizer, then they can access the hospital hubs through the single point of contact. And just to just see one hand up, and I just think we could open, if other people have questions, you can put your hand up, so if you can see on your screen a little hand up button, or we'll open the floor in a moment for people to ask questions. But one hand up there I can see from Jiggy.
Thanks, Vicky. I've just had a couple more questions come through, if you're okay for me to ask those. So my question is, will it affect anyone that has issues in the past, such as an ectopic pregnancy?
So again, it shouldn't have any impact at all in terms of ectopic pregnancy. The way that the vaccine works in terms of training the immune system doesn't have anything to do with the way that ectopic pregnancies occur. And so, no. Essentially, you should be perfectly fine to have the vaccine if you've had an ectopic pregnancy in the past.
Thank you. No, that makes sense. Thank you. So also, similar question to anyone who has polycystic ovarian syndrome or polycystic ovaries.
I would almost give exactly the same answer I just did, really, which is you should be perfectly fine to have the vaccine in that circumstance as well. There shouldn't be any reason why you can't have it if you've got polycystic ovarian syndrome.
Okay, thank you. If another question is, if children are not able to have the vaccine, would it be safe to breastfeed after having the vaccine?
Absolutely, yes.
Yeah. So you've got our little case study there that, as I said earlier, that I'm breastfeeding my baby and Fiona gave me my vaccine. Yes, it is approved for women who are breastfeeding, and the consequences of getting COVID-19 and the severity of the disease, you want to protect yourself against that. And so having the vaccine not only protects yourself, but means that you, if the disease is less severe, then if you do get COVID, then obviously we would hope that you would recover sooner as well. So absolutely fine if you're breastfeeding. It is approved and licensed for you to have in that circumstance.
Thank you. Just one last question.
Oh.
Sorry, go on, Fiona.
I was just going to say that there are some patients that we are immunising in the clinics who are coming in between chemotherapy. So they are ill patients and they are desperate to have their COVID vaccine before they start their next cycle of chemotherapy, because their consultants are saying it's better that you're protected, because when you've had during chemotherapy, you're more vulnerable. And so if you can access the COVID vaccine, please do. So we are helping very at-risk patients have it in between cycles of chemotherapy. And I think if it's safe for them, it's safe for a lot of other people.
And there is work going on at the moment, because it is a newer vaccine, to look at breast milk and to see if there's any sort of positive effect for babies. We don't know yet, but with a lot of other vaccines, you get that positive influence for babies. So, for example, when you're pregnant and you have the whooping cough vaccination, the reason to do that is because it then protects your newborn baby. And so we don't know the answer yet, but there is lots of research going on looking at breast milk and seeing if there's a similar effect with the COVID-19 vaccination, but we don't have the results of those studies yet.
Thank you. There was one more question. It's to do with men's fertility and if there's any research gone into whether the COVID vaccine has any effect on men's fertility.
So when they did the trials, again, the vaccine hasn't been around long enough for us to have looked at this for years and years and years. But again, it is considered to be perfectly safe, and there is no evidence to suggest any concerns around male fertility. So again, it is better to be protected that way. In terms of did they look at any specific trials or data, they didn't specifically look at that area, but certainly it is encouraged for everybody to take it that way, and there is no evidence at the moment of any impact on male fertility.
Thank you. Thanks both.
Oh, Vicky,
you're on mute.
Sorry, I was on mute. And I was just going to say, if there's anybody who's on the call who would like to unmute themselves and ask a question, or anyone who's on the phone who can't see the questions, if you'd like to ask a question to Fiona or Aditi, please do so now. Would you like to ask? I can see from some staff there. Hello.
I can see lots of people working very hard in the background.
We're from Rosie Nursing Home.
Hello.
Hello, welcome.
Hi. Hi. So our staff nurse Teresa has a question to ask.
It might sound foolish. I just want to know if you have allergies, let's say like the flu vaccine and different allergies. What would be the implication for the COVID vaccine? Would one be able to take it as regards to the allergies and all that? Would it affect you?
Do you want to start answering it, Aditi?
Yeah, so can I ask, when you say allergy, did you mean like an anaphylactic reaction where you have breathing problems and it might be a very sudden onset type of reaction, or was it something else? Because it sort of depends a little bit on that.
Right, okay. Just allergies, like if you are allergic to, let's say, somebody who has never taken the flu jab, and she says she's allergic to things like that, so she wouldn't take it. So would it affect her if she takes the COVID-19 vaccine?
Okay, so I think if they've had a severe reaction to a vaccination before, then it's important that that they go through the questions in terms of what we talked about before, if they're allergic to any of the ingredients in the vaccinations, and also if they have an allergy to 2 or more groups of medicines. So it's quite difficult to give a specific response to your question, because I suspect we would need to go through whoever's allergies it is and go through their medical history in that way. Now, if they had a very severe anaphylactic reaction to one ingredient, then it may be that we have to use the Oxford AstraZeneca vaccine, but it does depend on what they've reacted to in the past. If we think that they are really severely allergic to lots of ingredients and we can't give it within the a certain setting, then we will make sure that they're given it in a setting where we can observe them and make sure that we've got everything on hand should they have a severe allergic reaction. I don't know if that answers your question. Fiona, did you want to add anything to that?
No, I think you've answered that well. So, but if anybody's got any queries, they can ask specific questions when they come to the clinic. No question is a daft question. So you can ask any questions that you want to ask, and we will be happy to answer the questions with the knowledge and information we have.
Yeah, and one more question, please. Can I ask my question?
Yes, go ahead.
Yeah. Please, what's the difference between the two vaccines? What are the differences between the Pfizer and the other vaccine?
So the two vaccines, the Pfizer and the AstraZeneca, they work in slightly different ways in terms of their mechanisms, but their ultimate aim is to reduce the severity of the disease. So if you were to get COVID-19, their aim is to try and reduce how severe it may be. The Pfizer one, it works by something called messenger RNA. And what it does is it stimulates your immune system to create a response. So the messenger RNA creates a protein, and that protein tells your body to create an army to try and stop that as defense against the COVID-19 vaccination. The AstraZeneca one uses a slightly different method, which is that it uses an inactivated virus, a different one compared to COVID-19. And what that does is, again, stimulates your immune system to create an army against the COVID-19 virus. So whilst they work in slightly different ways, their aim is much the same, which is to train your immune system that if you ever encountered the virus, that your immune system would be ready to fight it. And so hopefully the severity of the disease would be less.
Thank you very much.
You're welcome.
Yeah, one more question.
If you don't mind, okay, I have to go for my vaccine on Thursday. Now, let's say they give me the first one, what's the name of it? I can't remember.
Pfizer.
The Pfizer. And then after 3 or 4 weeks or so, I get the other one. Would that be okay? Or
No.
they have to give me that?
I'll let Fiona answer.
So whatever vaccine you get given first is the vaccine that you will be given as your second dose. So you must have 2 AstraZeneca Oxford vaccines or 2 Pfizer vaccines. They are currently not interchangeable, or they recommend that they're not interchangeable. That is the current advice.
Vicky,
Okay, I wasn't hearing properly. I didn't hear properly, sorry, because somebody came at the door.
So I will repeat it again. Whichever vaccine you get on Thursday, you will need exactly the same vaccine in about 12 weeks' time.
You can't mix them.
You cannot mix them.
So
It's
if
got
you
to be
have
the same vaccine.
So if you have the Pfizer one on your first dose, you have Pfizer on the second dose. If you have AstraZeneca as your first dose, the Oxford one, then you have Oxford AstraZeneca as your second dose. So don't mix and match. Stick to the same. You wouldn't have 2 different shoes on. You would want the same pair of shoes, looking the same, and the same that way. That we want matching shoes, not a slipper and a boot.
I understand. Thank you very much.
You're welcome. And I think Debbie's made a really good point that in order to keep everybody as safe as possible, if we're sharing a space with other people, keep your masks on, because it will just protect all of us that way, because we want to keep you as safe as possible so that you can carry on doing the wonderful work that you're doing. Thank you to all of you there.
Thank you.
Thank you. Do you have anybody else on the line or on the call who would like to ask a question of Fiona or Aditi? You can unmute if you'd like and ask a question. Or anyone on the phone who's dialed in who would like to ask a question? Checking.
Vicky, can I just share with everybody? I know that everybody either knows of somebody who's had COVID or has or knows of somebody who knows somebody who's had COVID, and to have the COVID vaccine, you are more likely to have milder symptoms from side effects than you would have if you have COVID itself. So it's recommended to have the vaccine and not get COVID, of course. But I just wanted to share with everybody as well. So whilst you're around people, just make sure that you have your masks on above your nose. I'm sure everybody's doing the best they can with this. So have your masks on above your nose, and when you're near people, keep that 2 meters distance. And if you're caring for people as well within your work, just wear that PPE, wear those gloves for any specific medical procedures that you're doing, and take all the precautions you can.
Thanks.
Thank you.
Thank you. Is there anyone else who'd like to ask a question over the line, a live question?
Hi, good afternoon. I'd like to ask, if you do get the vaccine and then you do end up getting mild symptoms of COVID, would you still have to isolate for the recommended days if you still have the vaccine?
Yes, so if you do have the vaccine, regardless of that, if you get symptoms of COVID, so dry cough, headaches, any of the symptoms that can develop during COVID, you will still have to notify your employer that you're symptomatic, and you will have to go off for a test, wait for the results of that, and if it's positive, you will have to isolate for the recommended amount of time.
Does that answer your question, caller?
It does. Thank you very much.
So I think some people, I remember we did a talk last week, and one of the doctors said, well, if I have to do all those things, why should I get the vaccine? But I think the key thing, isn't it, is that you will not get as sick if you've had the vaccine. Is that right, Fiona and Aditi?
That's right.
Because some people might think, oh, why get the vaccine if you still have to isolate? You still have to use your PPE. But I think just reinforcing it.
About 1% who get the COVID disease will get it very badly and may die. And we have to bear that in mind. And an experience in the hospital is not always a good experience. And there are a lot of people that come out of hospital who've had COVID that are still having symptoms many months afterwards. It's called long COVID. So we don't want more of those patients coming out with long-term health problems. It is better to do prevention than take the risk and become unwell. And I have put something in the chat about vaccinations saving more lives and preventing more serious disease than any advance in recent medical history, apart from clean water, of course, which always wins.
Thank you, Fiona. We've got time for a couple more questions. Would anybody else like to ask a question over the phone or a live question?
And I think just to add that it's really normal to have all these questions and have those concerns. Our job is to try and answer some of those questions for you or point you in the right direction if you want more information. Of course, if you were asking my opinion, I would say yes, please go and get vaccinated, but you've got to make that choice yourself. And so you know, Fiona and I are here to direct you towards the correct sources of information. There are lots and lots of social media, WhatsApp, all kinds of things which aren't giving the correct information. And so what I would urge you to do is when you do want the information, please go to the correct sources, the approved sources, ones that are backed by evidence. Quite often there are, you know, sort of, we're hearing about all kinds of false information that's being given, and we really want to make sure that you have the correct information to make the correct choice for yourself and for your loved ones and the people that you're caring for.
Okay, I wanted to ask a question. Are there any statistics of anyone who's died after having the injection, the COVID injection? Are there any statistics kept about that?
In terms of the UK or the wider trials, did you mean? UK. So we at the MHRA is the organisation that collects all the data in terms of side effects from vaccination. As far as we know to date, nobody has died as a result of the vaccination. And what will happen is that any other side effects that are reported are collated, and they will report on those side effects. But to date, the MHRA hasn't reported on anybody who has died as a direct result of having the COVID-19 vaccination in this country.
Okay, thank you.
I think that is a really good question, because we can say nobody's died as a result of the vaccine, but how many people have died as a result of COVID? It's in the thousands, isn't it? So, yeah. Thank you. That was a really good question. Really good question, caller. Sorry, I ran the wrong way. I know we're coming up just to 3 o'clock, but we could probably squeeze in one, maybe two last questions if anyone would like to ask a question.
Asking a personal question now. Have any of you all had COVID injections?
Yeah, so I had the AstraZeneca one a couple of weeks ago, and I did have some mild side effects. My arm was aching. I had a little bit of a headache, and I felt really, really tired. And that tiredness went within about 24 hours, and I was completely back to normal. But it did mean that for those 24 hours, I've got quite young children, that my husband kindly looked after them and let me put my feet up, because I just needed that time just to rest a little bit. But I was absolutely fine afterwards, and I didn't even feel it going in when it was done. So that was my experience anyway.
So I've also had the Pfizer vaccine, because I was running the first clinics, and I also had my second dose before the guidance changed, that they were increasing the time span between the first and the second dose, and I didn't have any side effects at all. Nothing. I carried on working. It was all positive. So I think some people have side effects and other people don't. And it just depends on the product. I mean, I've had my flu jab I've worked in practice for the last 26 years. I'd have said I've had a flu jab every year for the last 17 years. Some years I get a little localized reaction. Other years I don't get anything. I just think it's potluck. But the flu jab is another thing that is really important. So if you are going to have the flu jab, there is a time interval of 2 weeks between the COVID vaccine and the flu jab, or any injection. You need to let them know. We don't know why that time interval is, but that's what they recommend. So most people, even in a care home, would have had their flu jab before Christmas. Some would have had it just after Christmas. So as long as it's a 2-week interval, that's fine. That's fine. And we always check that when we go into care homes, because we go into care homes en masse to give the flu jab. So we will have known when we gave it. So
and
that's
some of
an
that,
important question to ask.
yeah, I agree with you. So the minimum the government's saying is a week, and we're more cautious locally about that in terms of the spacing between any vaccination. But actually, some of that is more that if you have them too close together, you won't know if you have a slight side effect which one it is. So having that space also enables us to know some of those side effects that I mentioned to you. And of course, we're still collating the information around those side effects. So if you do have them, you can report those yourself via the MHRA website, or your GP can do that for you. And that's so that as the years go by, we'll have more and more information about these vaccines, just like we do about all the other vaccinations like flu, whooping cough, all of those, which is really important as well. But yes, we've had them. A lot of our colleagues have had them. Personally, my husband's had his. He had the Pfizer one. I had the AstraZeneca, and we're all fine.
Okay, thank you. There's one other question I have, if you don't mind, is maybe I missed it and you were doing the talk about currently what is the waiting period for the Pfizer after you've had the first dose? Is it still 12 weeks? Yeah. And also for the Oxford one, what is the waiting period? You've probably mentioned it and I've probably missed it, but if you could just repeat that, please.
So currently the recommendation is that you will have to wait up to 12 weeks post first dose to get your second dose. We cannot specify any particular time because it's all dependent on vaccine supplies.
And I would just say, in terms of your first dose, you should have no waiting period. As I said, we've got the links up above. So yeah, email right now if you like, and someone will get back to you this afternoon with a self-booking link, and they do have spaces this week. Yeah.
And that might change as more priority groups open, as the government releases more priority groups, that might change. So I think if you feel happy and confident to have it now, then please go ahead and book, because as more and more people become entitled to have it, as the government guidance starts to open up more and more groups, then of course there's going to be a wide number of people that we're going to be vaccinating at each stage. So I would say don't delay it. It's better to protect yourself now. And if we have that availability now, that's fantastic. Try and embrace that and get yourself protected in that way.
Thank you.
That's great. Thank you. Thank you very much. Some really helpful and practical questions there. Thank you. So a huge thank you to Fiona and Aditi for joining us this afternoon. I think some really good questions and really useful information to help people to make that decision. As we said, we've sort of talked through the process. If you do still have questions afterwards, is probably one is talking to your GP. I mean, I think the other thing, if people kind of still concerned, you can always email the email that we have to make the referrals. We will get in touch with the clinician. You know, obviously it's more about sort of general questions. We're not a team of clinicians, but we obviously can try and route you through to get you that support. If you feel like there's nowhere else that you can go to, we'd rather try and access some support for you. Yeah, so as I said, thank you very much for all joining us today. We hope you found it really useful. And Jiggy, I think are we putting this one together as a link afterwards that we can share out?
Yes, possibly. We're going to talk to the comms team if this is possible to do.
Okay, thank you. And on our website, as Jiggy put earlier, that we do have some links to previous Q&A webinars, which were not just a women's health focus, so that, I mean, obviously we've talked more broadly, but they covered a wider range of issues which you're welcome to access. And do share the links if you've got colleagues or friends who are concerned as well and they're eligible for the vaccine. But yeah, a massive thank you to Fiona and Aditi. Been so helpful having you on board this afternoon. Thank you for your expertise, and thank you everyone. And we really hope it's helped you make that decision, and that we see your applications coming through. No, so thank you very much, everyone. Please keep safe and stay well.